Today's guest is on a mission to fix a system we all rely on, but few of us actually understand. From the front lines of intensive care to building a company that's reimagining how healthcare is delivered, Matthew Jubelius is bringing speed, access, and most importantly, humanity back into the conversation. We're going to dive into systems about leadership, burnout, and what the future of healthcare really looks like. Matthew, welcome to Retaining Purpose.
Thank you. It's awesome to be here, Andy.
So we have crossed paths, but never formally met. I think we actually had a moment where we were trying to get introduced, and then that kind of fell apart a little bit. I think I skipped a coffee date, if I'm not mistaken. But yeah, good to have you here. I'm excited for this.
No, it's awesome. We get a chance to see each other from the opposite end of the rooms because we're both tall guys. And now here we are face to face.
Yeah,
so
exactly.
It's all
we can see over everybody.
Yeah.
Right? So awesome.
Yeah.
Healthcare. Canadian healthcare. Mm-hmm. You know, I think healthcare in almost any country is a bit of a hot topic. Healthcare in Canada, obviously it's in the news all the time. Big money, bad service is the typical way it's going. Why are you here? Walk me through why Matthew Jubelius is doing what he's doing today.
Yeah, thank you. Kind of the origin story.
Yeah, the origin story.
All
exactly.
Right. So I'm celebrating my, I think, 21st year in healthcare. And when I first started, again, I wanted to change the world and had the opportunity to have a career of a lifetime in the sense of just an inside look at a different level of humanity in the sense. When you get into healthcare, you see people at their worst. It's not something that I necessarily brag about, but you see who people are, I think. And then for me, I'm reflective by nature, and it's been able to influence how I see the world and then how in turn I respond to the world. So I first started out in cardiovascular intensive care, and it was an exponential learning curve. Typically, you have to have several years of healthcare experience to be considered in there. So I had some people that really believed in me right out of the get-go. And again, thankful for mentors along the way. Even to this day, I still have mentors. And, that really was a wow, in the sense that we realized that life is fragile but life is tough and people are tough. But then we dig a little bit deeper and we understand how complex people are. So I started very much on that individual, like person-to-person approach because, making sure that, you're making sure that really somebody doesn't die. That's something, that's your job. And that's what a lot of healthcare is trained for. And how do you stave off that natural order? And we have chemistry and biochemistry to thank for that. And again, amazing teams. So it really taught me the value of teamwork from the very beginning. And I'll give you an example. So every day in the cardiovascular ICU, we would do rounds with an intensivist. So think of a physician who is specialized again, and then they've specialized again. Okay, so like these men and women.
This is it.
Yeah, it's I would say tongue in cheek. If you ever were in this, intensive care, I would call it the last chance for romance. Dark humor is sometimes how you deal with things, and it gets you through the day. So we would deal on rounds. And so what would happen is you would sit with the intensivist. So as the registered nurse, again, you were responsible for the patient care for a 12-hour shift. And I still remember, again, being a young graduate, still within my first 2 years of graduating. And the intensivist looks at me and says, "So what are we going to do for this patient?" Well, they didn't really teach you that in school. So, learning to become assertive, learning to, again, think bigger picture, not just, again, react to what's happening. Say? Exactly. Yeah. Right. So definitely the application and theory is great, but it's a groundwork, but it's not dynamic.
Right.
So again, you understand the value of team. And further to that, when the intensivist understands and also says, okay, yep, that is a good plan. Let's do that. It's very validating and I think empowering. So that's how I started my career. I went into general systems. I went into teaching as a clinical instructor. And I was actually on my way to Boston or Florida to do my master's in anesthesia.
Oh, wow. Okay.
I dropped out of pharmacy and pursued nursing. So I've always been fascinated with, what medications can do, but the why. So that's always been kind of like the why has been one of my motivators.
Yeah.
Along the way, I was, again, like I could never have predicted where my career would take me. I had this clinical job and someone said, hey, have you ever heard of this thing called simulation? And so it was medical simulation.
Okay.
And at first on the outlying surface, it was about simulators and, the robotics aspect of it. But deep down, actually, when you started understanding it, it's about cognitive science, human performance. So I was able to really learn about human performance under stress and pressure. Along the way, I kind of got a tap on the shoulder from Defense Research and Development Canada.
Really?
DRDC, so they're an arm of the Department of Defense.
Yeah.
And I was selected by the Surgeon General of Canada's office to work with national level and scientific teams.
Wow.
To work with medical folks for, again, safety and security of Canadians. Again, very, very humbling experiences.
And early, right? Like this is like, how old would you have been when that?
32.
Yeah. So to me, I might be ignorant in this, but it's a pretty young age to have that shoulder tap.
Yeah. It was unexpected.
Yeah.
Again, it was just like, I believe in just doing good work.
Yeah.
Just do the work.
Yeah.
So again, had the opportunity to do that. I was fortunate, as my career had developed. I was an international guest lecturer at Emory University in Atlanta, Georgia, or Decatur, technically is where it is. And, have had, more leadership opportunities throughout my career, senior leadership teams within healthcare, focused on the health and the wellness. I became really passionate about not only patient safety, but people, because I watched my colleagues around me drop due to injuries, due to, safety, occupational issues. Yeah. And so I really got passionate and really jumped into, occupational health and safety. And again, combined with my management experience, understanding, stress, performance, the integration with systems. I'm a dork. As we go along, I just want to throw that.
We need dorks in the world, Matthew.
Yeah, so, it's, this is just my story, my journey. Yeah. So the opportunity to, contribute and just really help people has been a real core theme throughout my life. And I wouldn't have it any other way. So fast forward past, senior leadership, and, it's now 2022. We are kind of post-COVID. Everyone is still, I'm looking around our community and no physicians are taking patients. And so I said, this is ridiculous. There's got to be a way.
Yeah.
So I went to open a clinic, a primary care clinic, a virtual opportunity, because we were still under a lot of restrictions. People are very psychologically fragile. They don't
even want to go out.
Right. And it's, I think a lot of, it's post-traumatic stress with, I think, what happened with COVID for a lot of people. But I also looked at it because I went to the front lines to work during COVID. And I looked at, certain health systems and how they were treating people in the sense of from a human resources aspect. And I'm not throwing any shade at anybody, but I'm looking around and I'm going, you are creating a mass exodus HR-wise, and we're seeing it. So Stats Canada says by 2026, 24.4% of nurses nationally are gone. which means retirement, burnout, leaving the profession. And, we can get into more of like that whole aspect after. But when we started VirtuClinic, again, it was because our community itself had no ability to have additional resources. So I really doubled down. I threw all my energy in. This wasn't a part-time pet project. It was like, this is who we are.
Full steam ahead.
So we started as Virtue Nurse.
Okay.
And it's interesting. So talking about the ability to change and listen, and again, being open, I think is something very valuable. And so what had happened, again, when you're starting something new, people are like, yeah, man, this is awesome. This is great. And then as time goes on, people are like, I don't need a nurse. I need a clinic.
I need a doctor.
I need a clinic. So again, it's like, okay, cool. So, essentially you have to start another business, on paper, but also from a brand identity and so on. So we've been doing this since 2022. We've had, again, a heck of a journey. We've had a team of 8, as big as 8 across the province. And we've evolved from primary care to employee wellness, to medical legal aspects, so legal nurse consulting, and then again, providing leadership as well. So I've mentored managers and leaders and CEOs throughout their career as well. Sure.
So you mentioned, your why, right? So was there a definitive point where you're like, other than through COVID, but you're like, the healthcare system has just lost its why, and I want to go find it?
Yeah. I think younger, I was about achievement in terms of seeking my purpose. And again, I looked at how my life was even as a younger kid and trying to figure myself out in the whole world and how I fit into this big old spinning rock. And I said, you know what, like, I want to contribute. I want to help. And I think that leaving it open like that and being able to find a way. So getting to that definitive point, it's an interesting story. Sometimes innovation is born out of frustration. And, so I, at the time, was working as a contractor, and this particular company just decided to end my contract. Wasn't through performance. It wasn't through anything that, again, job related. And I remember hearing it from a lot of people. This is about money. Yeah. It's not about you. It's about the contract. And I go in my head, I said, okay, well, healthcare, is it about people or is it about business? And for me, in terms of my morals and ethics, again, it's people. I want to share an experience with going back into cardiovascular ICU. I had an intensivist at that time said, make sure you take extra special care of this person because they're worth $32 million. And I looked at this physician and I said, I'll tell you what, I'll treat them exactly how I treat everyone else. And it's not a hero story, but it's again, like, it doesn't matter how much money you have in the bank. You're lying in the bed. You get the same care. You should. You should get the same care. That's right. Yeah. And I think often you do hear the stories about, tiered care levels and everything else that goes along with it. So with VirtuClinic then, so obviously it went from Virtue Nurse to VirtuClinic. So where are you fitting in right now? What I would say, and we chatted about it briefly, or at least said we're going to talk about it, into, Canada is known as a public healthcare system, right? And I think we all know there's private elements to that. Where are you fitting into that mold right now? Yeah, very interesting. So, or a peg round hole? Well, you again, part of who I am is you find a way. You find a way for the solution. So when we first started, I went to Alberta Health and actually tried to register as a public clinic. Right. However, due to the legislation in the definitions, we did not qualify for public funding. So the question right out of the gate was, do you give up or do you find a way? And again, through a wonderful team, again, drive, grit, all that stuff, we found a way. So by definition, we are a private entity. However, a lot of people come to us and say, well, you can charge a lot more. But I go, why would we do that? Like that's not what this is about. That, and also we found a way to deliver our services, cover the fee structure while not putting people out of pocket. So we found a way to, have that out, like that net zero, if you will.
Live in the public, but operate as private kind of thing.
Exactly. Yeah. So we were able to do that. And, that's it. You find a way, you solve the problem.
So then from a standpoint of, how are people finding you? What are because I think it's evolved, right? Like now you're talking, obviously working with businesses, you're mentoring CEOs. Like, is that a key focus of yours right now? Is business and working with the leadership there to really understand how good health, be it physical, mental, or whatever side of the health spectrum you want to look at, leads to better employees, happier employees, more productive employees, better employees at home at the end of the day, right? Better family people. Is that kind of where you've found your niche right now, or?
Yeah, I still see patients.
Okay.
Again, for me, that's never changed. But the way my brain, I think, has evolved over the course of time too, is saying, okay, like when I look at from a systems focus, right?
Yeah.
And from an organizational focus, not just to spew data, but, we look at what's happening with mental health. By the age of 40, 50% of us have had some sort of traumatic experience, whether divorce, firing, loss, grief, like all this stuff. So it's pretty safe to say we all have stuff. Okay. So if we know that that's kind of underlying with the human condition, then we say, okay, now we go to work. Now, we, as the leaders of an organization or management, I think you have to really educate them to say, you don't know the picture entirely.
Right.
A lot of decisions are made, again, for the business without factoring in people behind it. So where I operate now is working, again, with senior leaders and saying, okay, well, we can look at this several different ways, but using health and wellness as a strategic initiative, not an after the fact thing, but saying, okay, here's the data that backs it up. But if we now design a system where health is a priority of your strategic plan or embedded, again, we can embed it into culture, the data speaks for itself. And for example, our 2025 data verified that 4.6 hours back into your productivity per appointment compared to the traditional system.
Right.
So if you start running some numbers from a business perspective,
adds up quick.
That adds up quick.
Yeah.
But again, going beyond the numbers of saying, okay, now again, we're not leaving people for 8 weeks. It's like they need a prescription renewal or they need somebody to talk to. Again, going back to this mental health thing within our community. So again, being more rural compared to larger centers, again, access, it remains an issue. Specialists remain an issue.
Yep.
So if we were to kind of, again, listen to the system and then kind of, again, make your own assumption. So in order to, for example, see a psychiatrist or get referred to a psychiatrist, the waiting time was about 10 to 12 months.
Okay.
So now let's backtrack. Okay. Now we know that a lot of people don't have a primary care physician, right? Access.
Yeah.
So if you're experiencing some sort of mental stuff, okay, how do you get in to find somebody who's going to help you from that way? Because the question is a walk-in person, like is a walk-in clinic going to provide that referral? I don't know the answer.
Maybe not.
Right?
Yeah.
Exactly. So again, now you're at a bottleneck.
But it's also a physician that doesn't know you.
Very true.
And that makes a big difference.
Very true. So, it's kind of going, okay, well, you're flawed from the start. And so you think about it again now on not just a medical thing, but like if you're to put yourself in someone's shoes, so now like really empathy. And again, your world is falling apart. You've got stuff. 10 to 12 months, like that is torture.
Yeah.
And so we saw that as well when we first started. And that's why we integrated mental health services into our clinic.
Right.
So that if somebody, for example, is experiencing stuff, they can be seen same or next day. And then again, through our team approach, we have the information that can be shared with the nurse practitioners and clinicians and, mental health folks. And we can actually, we call it manage a patient within about 2 days.
Wow. Hey.
Compared to 10 to 12 months waiting.
Yeah, exactly.
So that's the impact that we deliver. And it's because of our amazing team that does this. Like this is how it's possible, because we get it. Like all of our team, it really is a shared vision. It's like we all want to help. We're not burnt out, but it's like people need the environment to thrive. And again, when it comes now deeper into a leadership approach, that's where it comes like, if I'm not empathetic, how do I expect my people to be empathetic? Yeah,
and it's interesting because, obviously COVID changed a lot for everybody, especially on the virtual side of things. So have you felt, I want to ask you this, and then I want to dive into that strategic versus non-strategic side that you're working in, right? But do you feel people are more open? Like, I love the idea of a virtual visit, kind of like a virtual Teams meeting when you don't have to go somewhere to do it, right? Are you seeing people go, oh, this is super valuable. I don't view it as awkward. I'm talking to somebody on a screen, but it's in the now, and I don't have to wait. Like, is that something you see people are just, this is okay. It feels a little weird, but it's okay.
People actually get over that weirdness really quickly. And again, it's again, a therapeutic, a professional relationship, right? And it's like, okay, like when we get into our secure encrypted platform, it's like, hey, I'm Matthew. I have an understanding of why you're here today. Let's get into it.
Right.
And again, people want care. They don't want to sit around and again, just wait and talk about the weather. It's like, let's get after it. And let's get you on your way. Because
sit in the waiting room.
Yeah, well, exactly.
Someone might have been in one a little bit earlier.
Exactly. And that's just it. Like, and we have that ability to actually see people earlier. Like, again, through our technology, we, again, on our back end, if it permits during our day when we can see people a little bit earlier, we can do that. So it's quite a flip from the traditional model.
Do you think it's funny, I was just reading something a while back, going back to when there were house doctors, right? It almost feels like somewhat getting a little bit back to, I'm coming to you in a way.
Yeah.
You don't have to come to me.
Yeah. Well, again, and making it easy for people because your time is very valuable. And I looked at it too. And as we created the systems, I don't think that people's time is really valued, right? Because again, it's no shade on any of the physicians or anything like that. Again, the current system.
It's the model we live in. Yeah.
And we say, okay, you will wait to see the doctor. Okay. But if from a data perspective that you, again, as an employer or as an individual for a 15-minute appointment, give up 4.6 hours of your day on average. How does that make you feel? Like, does it make you feel valued?
Nobody wants to go to the doctor, right? Like, we all know we're burning hours.
Yeah.
Whether it's in walk-in, even if you have an appointment, the chance of getting in on time is usually pretty loosey-goosey, depending what time of day, right?
Yeah.
So it feels like crap, knowing half your day is going to be spent likely sitting and waiting, and then maybe you got to go get a requisition, you got to go get blood work, and that's a whole other story, right? So no, I get it. Like I love this idea. So when we think about strategy here, because this is something, and you mentioned it earlier when we were chatting. So as a business owner, I've always felt really good about making sure my guys have health benefits. Right?
It's great. That's fantastic.
It's great. Yes. And part of that is, there's the extended health, whether it's, the massages, chiro, whatever.
Yeah.
But there's also a mental health services side of that, right? Mm-hmm. What does strategy mean to you? Like, I know your services don't replace something like that, but strategically, how do you, maybe from an employer standpoint, start to minimize the use of those programs on the back end, right? When you start to get out possibly ahead of a few things.
Yeah, again, kind of take a look at the current model. So like we use the term EAP, right? Employee Assistance Program, or
that's right.
EFAP, Employee Family Assistance Program.
Yeah.
The mental health component is, again, interesting. And I've had numerous people come back to me and again, they say the current models, the current tools that are being used or whatever, there's a reason why, those services are only used at 7%. Because they suck.
Yeah, totally.
Suck,
yeah.
And again,
a lot of people don't even know they exist within there, probably.
Very true. Yeah. And, but when people do, like, how's your experience? And again, who's on the other end? So you look at things like engagement and it still comes back to humanity and empathy. Like, if you can't look at somebody in the eye, and I'll give you an example, talking about when you're assessing somebody or having an interaction, it's quite easy on the phone to, be very like closed off kind of deal. And it's like, how are you doing? Oh, I'm doing great. Well, if you're just paying attention to the voice, okay, cool. Like, let's move on, shall we? But like, clearly you can see something's wrong. Yeah. And I think that we can actually see that out in the community. We can see people are like hanging, holding it together. And they're just that one little step from the ledge, and it's very sad because it's like, we can do better. So these are all things, again, as part of the journey of saying, well, like, now we need to shift this. And again, we're very fortunate because when we can make change, we make change fast. Right. Yeah. There's the hoops aren't there to jump through. Right. Yeah.
So then with your team, when you think about, bringing this forward into communities, into businesses, your team now is currently 8. How do you manage and how do you lead that group to deliver your vision for what healthcare is to be in Matthew's eyes?
Yeah. So first of all, it's not about me, believe it or not. I don't even have my name on our business cards.
Yeah.
The relationship starts from the interview. Yeah. So again, when we look at fit, when we look at, again, you can establish people's motivations and really understand. You hope. There are some people, again, they're here to game the system and they're outliers that way. But you have to go in and believe in people. I think you have to trust people, which again it's a very different stance from, I think, the society that we live in. Because again, we look at social media and we look at all of this, like the highlights, right? Yeah. And it's like, okay, then you dig a little bit deeper and you're like, whoa,
there's a lot of lowlights in there too.
Exactly. So, from my perspective, the relationship starts from the first time that we connect. And so, again, for me to remain passionate and again, model that and again, help people understand why, like that's just through the interview thing. Right. It's not, the way we interview people has changed. It's not a standardized block behavioral based assessment, blah, blah, blah. It becomes more of a conversation. It's like, so like, why?
Right.
And from there, like, I can determine if somebody, again, just wants a minimal role, or again, it's like, okay, that's fine. But people have said, well, 5 years, I want to be the clinical director.
Okay.
So that already tells me that this person wants a development plan, and I've already started thinking about that development plan. So again, we're treating people like people, not just like, you're filling a vacancy.
And how big of a difference does that make when you treat the person like a person who you're expecting to treat others like a person? Does that make sense?
Oh yeah, that's a lot of people. Yes.
Yeah. You want to be treated as you're, expect others to treat you, right?
You would hope.
Yeah.
And again, business owners have it tough, making sure
finally someone admits that.
But the weight is heavy. It's very complex.
It is, yeah. And people are at the heart of it.
They are. And if you don't understand that, I think number one, your business is going to go very quickly. If you don't understand that this is about people, and even in management, I've studied a lot of management theory, and what was it? I think it was, this is a little while ago now. And I think it was the Sloan Management School, or I think I'm mispronouncing that one.
Yeah, I know what you're talking about, though.
But they said about like 70% of managers shouldn't be in management positions.
Right. They're there by default.
They're by default, but the way that people got into these positions were, for example, you were a star employee. So you're a star subject matter expert. And it's like, okay, well, there's no one else around. So now we're going to put you in this leadership role. Yeah. Well, this person knows nothing about people. They know nothing about, that psychology aspect of it. They, again, what does the organization stand for? Again, core values and da-da-da-da-da-da. And again, you've put somebody in this seat. You haven't trained them.
No.
So now you're creating a system where it's like sink or swim. Yeah. And some organizations really pride themselves on this, and throw them to the fishes or throw them to the wolves.
Old school
and see how they do it. Yeah. It's command and control, and it's outdated, and it's absolutely terrible.
Industrial revolution.
Yeah.
That's what it survived in.
Exactly. Yeah. So, when we start to say this is really about people, because they're your people, and they're people under your charge. You're not in charge of the people, but they're people within your charge.
Right.
So how are you taking care of your people? And this is where the generational workforce is coming in too, because, old school says, I'll jump ship for $1.
Yeah.
But now, Generation Z and Alpha and so on, coming in and saying, hi, how are you taking care of me?
Yeah.
And it's not a demand, but it's like they're putting it out on the table. It's not necessarily an entitlement, but it's like understanding the terms. Because I think the brochure that, for example, our generation received.
Yeah. And it's so funny because there are models out there that have survived on this for decades, right? But it seems like there's so few, and they never get the traction or whatever else. But I think there is and it maybe not a misconception, because I've seen it in real life where, you do get that person coming in, and it is, how are you going to look after me, right? And it can be frustrating as a business owner at times, because it's like, how are you going to maybe like play your part in this? I hate the word earn it, because I don't like, you either have a culture where you've built that, where we look after our people, right? And then it just becomes a fact of finding the people that also see value in performing, right? Yeah. But it can be challenging. I look at it as accountability. Yeah.
Right. And again, it goes both ways. So I think as an employer and, a mentor, a leader, a manager, whatever, it's like, okay, like, here's what I'm going to do for you. Here's what it is in return, kind of deal. Communication goes both ways. It's not, the chain of command. And it's just like, how are we solving problems together? But again, that kind of goes back into a culture rather than a reporting structure.
Yeah. Yeah. So when you think about accountability and ownership, I guess, one thing or at least I've seen, and I think a lot of people have seen, and I'm not going to pigeonhole like the Alberta medical system, Canadian, or anywhere else in the world. Accountability just seems to be a lost word. It's become such a bureaucratic nightmare in there that it seems like nobody is accountable, or everybody's accountable. And when everybody's accountable, no one's accountable. And at the end of the day, it's like a finger pointing session, right? That's something that you've seen, obviously, and something you're trying not to allow into VirtuClinic as well.
I think that true leadership joins people together and unites. And again, when we look at problems, and the problem here is about people and its quality of life and its access and its treatment and all of this other stuff. And I'm not trying to oversimplify the problem. It is quite complex. But I think that when we look at a leadership vacuum, and when we have a lack of accountability, again, that's where we look at finger pointing. We, start throwing shade at each other, or organizations.
Start throwing more money at it.
But again, without a plan, without
the proper leadership. The money's just
exactly,
and no problem solved.
And then again, it still comes back to the accountability, and you get the shoulder shrugs and the finger pointing. So it's
those are my favorite.
Exactly, right? But again, true leadership is saying, okay, really the buck stops here. Or here's the plan, but here's how we're going to get there.
Do you think we can get that within our current public system without tearing the whole thing down to the ground level?
Man, that is a very tough one.
Yeah.
My opinion right now, I don't think it's possible.
No. I don't think it is either.
Yeah.
I think it's just become too big, right? It's too politicized. But I wish it could.
It would be awesome to wave that magic wand. But again, when you look at the human element of it, and again, you have a lot of people that are there for good. But, for example, folks that want to do empire building, or, the office politics and stuff like that, right? Again, it's a division of what the mission is and what the values are. And what we're doing is we're creating this problem through these individuals. And again, now factored in from a leadership standpoint, and I mean this in the nicest way, if you're not willing to help, you're part of the problem.
Yeah.
And what do we do with problems? We solve problems. And again, as leadership, you're accountable. So
the buck stops with you. Right?
So I think it's every organization is different, and I can't tell people how to run their businesses, but I can share my experience. And I look at it, and for example, if you have a culture of workplace harassment or bullying, if you as a leader get wind of it and do nothing,
you're complicit.
You have officially or unofficially said that behavior is okay. So now you think about it from an occupational health standpoint. Well, we have psychological safety, the law to provide a safe workplace. So now you're placing your workplace at risk. Again, and why is it? Because you didn't have the accountability to have the conversation with somebody that says, hey, that's not cool.
It's one of the hardest things as a leader, right? Is that willingness to have the courage to have that hard conversation. They exist every single day, right? We all stare at them.
Yeah.
Are you willing to have it? Yeah. What, so you still probably have a lot of friends, colleagues, in the system that we currently operate under. What do they think about you? Not about you. Sorry. Yeah, that came across really badly, actually. What do they think about you? Do they think that you're an asshole? No, but what do they think about what you're doing here? Supportive of it, cynical of it?
Highly supportive, actually.
I mean, I figured they would be. Yeah.
Yeah. A lot of support. Again, people are just like, yeah, like you never really know who you have in your corner sometimes. And again, I look at it and I'm like, I'm just doing my thing. And we're just doing our thing. I don't focus on who's saying what or whatnot. We've been, again, I look at social proof. I take it for what it is. We've been operating for a few years now. We have 5.0 on Google ratings. And again, I take that for what it is. But I think what it does is it tells us, again, a trend, or again, the level of consistency. And that's what it's about. Delivering great care, listening to people. And that's what you will see and read. So that's, whether from, medical people who have written in, folks that we've helped, that's just wild.
So I just want to get my head wrapped around this. So business owner Randy, okay. I come to Matt and I say, hey, I want to work with VirtuClinic, right?
Yeah.
We then partner with you. And at that point, essentially the staff have access to the resources VirtuClinic provides.
Yes.
Correct?
Yeah.
Is the way it works.
Yeah, we have our clinical resources. So to back that up a little bit first, I think that it's more of an understanding, like let's get to learn about each other.
Sure.
Because your organization, your team is completely different from a military operations team or a healthcare team. So, and again, understanding your people or knowing your people, we have a conversation and to really understand what your challenges are and where you're struggling and where you want to see growth. So again, it's establishing support, but again, we factor in from that business element of saying, okay, if we're able to solve problem X, what does this look like?
Yeah.
So again, strategically, we look at that. So people, again, wherever they live in Alberta, have access to our online clinic within our scope of practice. That's not a problem. And we have our digital health advisors, which are actually a cutting edge tool. And I'll get into this one just for a brief moment. I think we'll talk about it a little bit more later.
Yeah. So I the next area we're going is probably where you're about to go.
Awesome. I wasn't reading your screen at all. But, when we look at, again, access and when you have challenges and, again, the current system, and when we look at, it's 2:00 in the morning, got work in the morning, unsure if you need to go to work. So you call HealthLink. And this is, again, reported from what I've heard from several sources where people have had to leave a message rather than being connected 24, right? So, but again, it perhaps is advertised as 24/7, whatever. Again, not my business, not my
24/7, the answering machine answers.
Exactly. Right. So like that's fine.
Yeah.
Our digital health advisors, they are world-class AI enabled, clinically designed systems.
Wow.
So what we're able to do is provide on-demand 24/7 mental health and physical support, advice, triage, and navigation. What that means in English is that when you need support, it's there right away. You can interact with this system. It's customized, but it's 100% private. There's no patient data that's recorded. There's nothing. So this is a game changer, number one. Number two, the digital health advisors speak over 30 languages. So now when we talk about, if all of a sudden you slip into, let's say your native language is Spanish, you go in and you start talking Spanish, it converts to Spanish. But again, even from an accessibility standpoint, you can talk to it or you can look at the words that are typing. Where the rest of the competitors are is they're just in chat bots. Sure. It's like you ask a question and it goes ka-chunk. And, there's issues there. Number one, with the ka-chunk, the amount of information. But further to that, the trusted advice.
Right. So your model then is trained, obviously, like it's intentionally built, AI backed. And would people ever know that they're speaking to a digital person?
Good question.
This is creeping me out now.
Yeah, no, yes. Again, I still think that people can tell.
Yeah.
Our first generation was a little bit more, I don't want to call it cartoon animated, but it was a little bit more two-dimensional.
Okay.
The most recent iteration of our digital health advisors are a lot more human-based. They still are, again, they're not live people.
Yeah.
So again, when I tie into, we look at even the science behind that, and not to go too dorky, but to be able to build that relationship with that technology or that system, well, there's an element of trust, because again, when we look at, again, come back to mental health and young people or younger generation workforce, they're more likely to trust like an online private thing rather than going and speaking to a counselor.
Yeah, I think I could totally see that, because it's easier to say things and be open almost when there isn't someone across the table from you.
It's private.
Yeah. Right? Yeah.
Because again, it's still your health. It's still your concerns. You don't need stigma. And again, when we look at, again, people are fantastic, but we also look in terms that people are complex. And I said this before. So the question is, although people are professionals, are they susceptible to gender bias?
Sure.
Cultural bias? Yep. Like again, like all
100%.
of this, like again, it's
human
part
nature.
of people. Yes, absolutely.
Yeah.
But now to create a system and a solution that solves the problem.
Right.
It doesn't care if you're male or female. It doesn't care. It's based on your problems and your challenges and how do we get there? And that's what it is. And that's what people need.
Well, yeah, and I think, let's be honest, Dr. Google has been around for quite a while, right?
Yeah.
Like a lot of us, we're already going down that rabbit hole. Like, I don't know, I've had more times than not where it's like, oh, this doesn't feel good. And next thing you know, it's like, I've solved all my problems.
Yeah. Yeah.
You Turns out degree. I didn't.
Yep. Yeah.
But so this is really a professional extension, I feel, of what we're already doing.
Yeah. Right? And when we look again in the bigger picture for us, right? When I talked earlier about this human resource mass exodus, again, just from a nursing perspective, we look at primary care physicians.
Yeah.
What's happening right now is that those residency seats are going empty or unfilled.
Right.
So what does that mean? It's a supply and demand issue still.
Yeah.
So again, even if we were to wave that magic wand and solve all of the, staffing, healthcare, professional stuff, workforce, you're still looking at years.
Yeah.
So
they're not there.
Yeah. So again, doubling down on the model that is no longer serving, like it's run its course. And I think that we have to acknowledge that. And again,
it's only going to get worse from this point forward.
I believe so.
Yeah.
And again, so now I look at it and go, how do we, for example, keep people out of the hospital?
Right. So why are we having so much trouble with this? Like, why? Like, I go, okay, Matthew, brilliant idea. I know there's others around the world doing it. I have no doubt about that. You kind of referenced it yourself. What is it going to take for us to just realize that what we've done and got us here isn't going to be what's going to get us into the future, right? Like, how do you, from a leadership standpoint, what does that messaging need to be like to the people that actually create policy and everything else?
I think it's time to really shift our perspectives. Again, historically, we've been very reactive. We wait for a sentinel event.
Yeah.
We wait for, again, and the cost is high, whether it's a human life, an injury, an amputation, like again, that's serious stuff. But we look and say, now what if we're able to change that algorithm, or what if we shift that so that we've now de-risked it?
Right.
And again, now talking about business advantages. And again, so leaders, I think, number one, need to give themselves just a look in the mirror, I think, and say, okay, like, how are we taking care of our people?
What's my role right now, and how am I doing?
Exactly. And it's like, are you accountable to shareholder price, or are you accountable to people? Right. Like, again, fundamental cultural
100%.
things.
Yeah.
So I think that people need to have that conversation, sit down as leadership teams and say, okay, like, what's the plan? And that's where you look at saying, okay, we're going to now say that health and wellness is going to be a strategic initiative.
Right.
It's not a cost, it's an investment.
Right.
Because when we look at being proactive in implementing this system, not only are you decreasing, let's say, leaves of absences, for example, mental health leaves, WCB claims, but you look at prescriptions, the amount of chronic disease management, like all of these downstream health costs that you haven't paid for yet, but you will.
But you will. Yeah.
We are now, again, altering that pathway to say, you know what? We've now decreased that by 25%. What does that look like as a business? Is it worth it?
Right. Yeah, that's really interesting because, and I like how you said that about, this is an investment, not an expense, essentially, right? And unfortunately in business, it has and continues to be, it cost me X, what am I getting, what is Y, right?
Yeah.
And I think one of the most challenging things in business is when you are investing in people, you never really know when that investment initially takes place, what the return is going to be, right? At least that's what I find. Like I invest heavily in my team. Sometimes it reaps rewards. Other times they're maybe slower to fruition. Maybe they happen at a different place of employment. You've planted a seed, it gets watered later. I don't know. Yeah. But that's one of the hardest things. And it's probably challenging to get that across to some business owners. I think I would have challenges at time, and I'm somebody who invests.
Yeah, it's a good point, Randy. I look at it this way, again, as when people are in my charge, and I say, as long as we're have a relationship together, again, I can't change the fact if somebody goes and looks for another job or anything like that. But if we're working together, I can make the environment pleasant. I can make you feel good, again, genuinely. We can work together. And again, when people look at fulfillment, to create an environment where you don't hate your job,
it's huge.
Yeah. I think that has massive value. When you're like, okay, cool, I come in and do my thing, I'm great at it. I get to make a contribution in whatever way, and everybody has their motivators. That's great, rather than, I got the Sunday scaries setting in.
Yes,
yeah,
Sunday
exactly,
scaries.
right? and that's it. But that's a form of anxiety.
Sure it is. Yeah.
So again, you're already entering the work week anxious.
Yep.
That's
it's
huge.
Monday.
Yeah.
Right.
Mondays are a write-off. You start waking up Tuesday. Wednesday, feeling the groove. Thursday, it's weekend eve. And Friday's a write-off. So, do
you work for government?
No, I don't. but again, you say it tongue in cheek, but it's when you start to dig in deeper, what if you create that culture where you show up, where you're accountable, where people are at their best, and again, for the most part, people will deliver for you.
Yeah. One of the biggest things I challenge with here, and there's so many things that have recently come up, and I've always known it's been a challenge. We're seasonal, right? Lots of times we don't even know who our workforce is at the start of a new season. And you have a small window to execute, right? We're in a 6-7 month window of execution. I struggle sometimes going, okay, can we just do the work? This, we just need to do the work, guys. And I worry about, and maybe I'll date myself with but coming across as too soft. Do you know? And I fear getting taken advantage of. So, in creating that environment, my biggest fear is just now all of a sudden, are you gonna? And I'm dying for your take on this. Are you going to affect productivity negatively or positively, right? And I know where you're going to say, but this is the mental struggle as a 52-year-old business owner. I'm in the middle, right? Like I'm not, the new way of thinking. I'm not the old way of thinking. I'm just trying to find my own little place to exist in life, right?
Yeah.
Harmonize, not balance, harmonize. So tell me I'm wrong. Tell me that you're going to get more productivity.
I'm not going to tell you how to live your life.
Okay, so he's in politics too.
I'm not sidestepping the question either. But what I'm looking at is, again, I think that we have to look and say, okay, again, what do you want out of your company? Mm-hmm. Right? And we talked a little bit about it before, about accountability, where we've started the relationship. Here's what I'm accountable for. This is where you can reach me. Mm-hmm. I'm here, for example, I'm here to help you succeed. My leadership style is very servant-based. Mm-hmm. And I say, I'm here to help you succeed. I'm not here to do your job, but I'm here for you as a resource, as a mentor. Okay. But you're still accountable for getting the work done.
Yeah.
And if the work doesn't get done, you don't have to sidestep the issue. The bottom line is that, hey, I invested in you. We've had these conversations on X, Y, Z.
Yeah.
So tell me now, again, what's going on?
Right.
And again, so now it's not just about a productivity. There is the underlying productivity, again, issue. But if you've created a relationship with a human, right, where you've built that trust and you've built the opportunity to say, Randy, I'm beat. I'm going through a divorce right now, and I'm getting raked over the coals, and I'm not sleeping. And man, now as a business owner, you understand that, and you're like, hey, why don't I get you some support? Why don't you take the day off?
Yeah.
Why don't you take a week? Like I got you, and that's a win-win.
Sure.
But I think a lot of people, again, because of the way some people operate, is, again, fear-based, command and control.
Yeah.
And it's outdated, and it's a poor model, and it's a burn and turn, and it's just like one of the day. Your time is going to be limited, I think, as a business.
Well, there's no question it is. The workforce now is saying, I don't want to work in that environment anymore, right? It's not for me. And again, speaking personally, it's just challenging, trying to thread that needle between pushing for productivity and creating the culture of productivity, right? Like I'm a firm believer in, you create a culture of learning, a culture, an element of a safe workplace from having no fear of failure, and all those things. It's that next step of, that what's the word I'm trying to say here? Not the medical side, but kind of the medical side, right? Reframing it from I said earlier, a Band-Aid on a bullet hole to early treatment in a way.
Get out of the way of the bullet.
Yeah. Thank you. Thank you. Yeah. Man, I'm fumbling my words.
All right. Mondays.
Yeah. It's Tuesday.
Just kidding.
Feels like a Monday. Get out of the way of the bullet.
Yeah.
Right. That's your job.
You can change it.
Yeah.
And again, I think that people and some leaders feel powerless or whatever constraints they have in their business. It's like, you know what? Let's drop it.
Sure.
Let's find the solution. So what's the issue?
Yeah.
But you got to respect people along the way.
Yeah.
And I even look at it this way: the language that we use is that I work with.
Right.
I never say someone works for.
Yeah. Yeah. I use the same language. Yeah.
Yeah.
Yeah, for sure. So what is VirtuClinic? What does the future have in store for you? 1 year, 3 years?
Yeah. Our digital health advisors, we are in the process of releasing something pretty big. We currently offer our digital health advisors for employers.
Yeah.
I think that you will see an opportunity where digital health advisors will be able for purchase.
Oh, you're kidding.
From an individual perspective. And so you can have a certain amount of conversations on your phone or your mobile device. Again, everything is private, everything is secure. And what does that mean? That you don't have to wait weeks for care. So you can have on demand. So we're going to change the world of care. We're going to do it again in a lot of languages. And we're going to do it globally.
And you're going to do it from Medicine Hat, Alberta.
We're going to do it straight from Medicine Hat, Alberta. And
that's what I love about this story, though. Like what you just said, we're going to do it globally. And you're here. It doesn't matter where you are.
Yeah, it doesn't.
Virtual.
Yeah.
Crazy.
We live in a great, awesome world. And it's just, again, why would we limit ourselves to a certain geographic area? Like part of our mission is like to break down those geographic barriers. Like that's who we are. And again, we can do that through our online clinic, through our regulated health professionals, right? We go all the way across Alberta. That is fine, dandy. But again, now, these aren't digital health advisors are very different from a regulated professional. And again, we can get into that specific language. But again, what does it mean big picture? You know what? If you have to access care because you need support, whether again, physical or mental, and it's literally at the palm of your hand and where you're told not to go to emergency because it's not an emergency.
Right.
Now, what are you doing? Like, again, downstream effects. We are decreasing the number of unnecessary emergency room visits. We're now bolstering emergency room staff because now they're not burnt out.
They're not as busy.
We're creating capacity in the public system, for example, and we have asked nothing from the public system.
You're worried about liability?
Oh, of course.
Right.
And that's why we have a great legal team. So all of this, again, we have ensured, and again, we have world-class AI, our chief technical officer, and has that specialty in all of that nerdy stuff. We have our legal team that has made sure that we are, again, going through
I's,
all of
T's,
that. And again, but when you look at it in terms of people, like everyone has their special gifts. I don't have all the answers, but again, as a team, we share the vision. We solve the problems together. But now you get to bring your nerdiness and who you are, and you're embraced for it, not penalized. That's culture. So that's how we're doing it.
Love it. So we're going to change the world in 1 to 3 years.
Yeah, it sounds
And it's going to move quick, though, right? Like,
it has.
Realistically.
The last 3 years.
This isn't like a 1 to 3 year plan. A 3 year plan is not long-term planning anymore.
And
it's probably out of date after the first year.
I wouldn't be surprised if we're in a different situation in 2 months from now.
Wow. That's crazy. Okay, Matthew, where can people find you? Give you a little chance here to kind of do a little plug for VirtuClinic. Where can they find you? And how can they learn more?
First of all, our website, VirtuClinic, so VIRTU clinic.ca.
Give her one of those.
Give one of those. .ca. You can also reach us at 587-864-3176. That actually connects you to one of our AI people.
All right.
And then you can have a conversation and we determine what support you need from there. So whether you're an individual who needs support from like a clinic appointment, you can get that. If you're an employer or a leader who really wants to understand how can they do that support for their people, again, we create that pathway too. And again, it starts with, again, a relationship. This isn't about we offer product X.
Right.
This is, we are about relationships.
Right.
And because it's people at the end of the day.
The product is people.
Yeah.
That's, and every person is different. So.
Exactly.
Yeah.
Yeah.
That's awesome, Matthew. I want to thank you for coming in today. I learned a lot, and now I'm also going to go check it out online. It's amazing to have you here. Excited to see what the future holds for you. And I'm sure we will once again be at an event where we can look over everybody and wave at each other from across the room.
You betcha. Hopefully we'll shake some hands.
Maybe.
All right.
Thanks, Matthew.
Thanks, Randy.